So as I said, I'm Juan Hernandez. I come from Bogota, Colombia, and I'm going to talk to you about elements of care in the preoperative phase to prevent complications after bariatric surgery. I have nothing to disclose. And I think this pandemic has shown us how people have theories and can imagine things, and they think they know how things work. And when we face our patients thinking on bariatric surgery, they think how they can manage the operation, how they can go through things, how can they manage the diet and be able to perform under these circumstances without really knowing what they're facing. And for that reason, the main objective in the first phase is to have a good education of our patients. Why we think they need an operation, what kind of operation they need, why they have to go through changes in preparation of the operation, a special diet, physical activity, psychological evaluation, and other things that may need to show them not only what's going to happen, but how is it going to be. And also that they may face complications, and how are they going to be worked out with the surgical team. So several points on our evaluation, and I'm going to talk to you about how we do it in our bariatric program, is going through psychological evaluation, and this is done in our hospital by psychiatrists. In some places it's done by psychologists, and that's fine. The whole thing is to be certain that the patients have a good evaluation on if they have eating disorders, mood or anxiety disorders, and if they are undergoing or if they need any mental treatment before they face the operation. Additionally, this phase, this part of the evaluation will also help the team to know if they have the knowledge and understanding of what the operation means, what they are going to face during the preparation, and assessing their social support. It's very important when the patients are going through these operations and the diet that they have the support of family or friends that can help prepare them and go through the whole process, and explore and prepare the patient for postoperative changes. The physical condition evaluation is also important because it's going to give us an idea of how prepared they are to take on exercise, or rather physical activity, because as we know, these patients have problems with articular problems or physical, cardiac or pulmonary problems that may hinder them to go through a physical activity program. So this phase prepares them to go through the operation in a better stage. The level of training, the physical condition, and the willingness to start exercising is very important to be evaluated, so we can know where they are and how can we improve on that. We know that patients obese patients in general are not very good at doing exercise or physical activity, so there are some studies that show that only 30% follow the recommendations of 150 hours. So we have gone even to use cardiac rehabilitation as a form to put them in form to go through the process of starting physical activity. Why is this important? Because cardiorespiratory fitness has shown to be important in terms of complication rates. There are studies that show that patients with better physical preparation go through less complications, the length of stay is shorter, and they feel better going to the operation. The physical activity before surgery influences exercise afterwards too. So if they have been preparing for this phase, after the operation, even feeling with lower energy, they can go through physical activity more often and in a better state of preparation. What is important to remember is that we don't have to only say to the patients, go do exercise, because we don't know what they are going to do. And we have patients with problems, cardiac problems or articular problems, and if they go unsupervised to high intensity activity, they may hurt themselves and hinder the operation. The other part of our preparation is the nutritional evaluation and support. This is carried out by a professional dietitian that is prepared on bariatric patients. And apart from doing a very good clinical history, it's also the exams that allow us to know if there are any deficiencies. And this is the person that is going to be in charge of the diet during the whole process, before, during, and after the operation period. This is the person too that has the most communication with our patients. They are permanently evaluating how they're going through the diet and how is it going in their process. If they feel weak, is the dietitian that they usually call. So this gives the best communication with the team. Additionally, they prepare the patients for postoperative physiological changes, as the surgeons and the psychiatrists do. I have emphasized this because preparing the patients to know they are going to go through very important changes is important, and help them to face them better after the operation. This is a form we use. It's called the Risk Mitigation Assessment Form. And what it does is allow us to be aware of conditions or situations that may become complications. So those risks of previous or current conditions, situations that they have lived before during anesthetic or surgical procedures, and the medications they are taking right now will prepare us to inform them what they need to do before surgery, after the surgery, and what things need to be changed or prepared beforehand to avoid complications, to avoid those risks to become complications. And the final point I want to talk about is how all this preparation, physical, psychological, and dietary preparation, are important to prepare our patients for surgery, but also how cautious we need to be around them. There is a long-lasting controversy about preoperative weight loss. If you check the literature, there are opposite results in terms of what effect has the weight loss program, or have the weight loss programs in preparation for bariatric surgery. And in some countries in America, patients need to go through mandated weight loss programs. There are some insurances that if the patient doesn't lose any weight through a specific program, they may not approve his surgery or her surgery. So the point on this is that they may not make harm, but they could produce shame, delay of the surgery, or desertion for bariatric programs if the patients are not successful with these plans. And maybe the insurance may not approve the operation. This is so important, the ASMBS has issued a statement saying that these insurance-mandated preoperative weight loss programs are not supported by the evidence, and they have not shown that the patient will do better after the operation, and therefore they should not be mandatory. And they even say that putting this through, or putting the patients through these programs may be unethical in that kind of, in that form. But there are also very good studies. We know the Scandinavian Obesity Registry and the results they have shown us through the years. And they have some studies that show that after the analysis of 22,000 patients, the patients in the extreme quartiles of the studies show a very important difference in terms of risk related to the operation and reduction of complications, up to 13%. In conclusion, preoperative evaluation is for us very important. We think has a very important weight on how the patients fare after the operation. Although there are not quality studies that support these weight loss programs to be beneficial, we do see our patients changing during the process. Weight loss does matter. And they do help the patients to understand the changes they will go through the process and after the operations. They know they have to keep dieting, they need to keep doing exercise, and they need support from family and our psychological partners. And therefore, they need to take responsibility of their own outcomes. And therefore, they need to be serious about the preparation before surgery. However, and as ASMBS says, this failure of improving in the process, losing weight or improving their physical condition, should not stop the operation. The operation should be done even if this happens, because the best treatment in severe obesity patients is surgery. Thank you very much.